Hello, everyone. Today is day 4 of the Dr. Joanne Lewis Heart Disease Awareness Walk. For the month of February, every day, we will take 15 minutes to walk with you. The videos may not be 15 minutes long because it's hard to upload 15 minutes of video, but we will be walking with you for 15 minutes every day for the month of February. And that's to raise awareness of heart disease, especially in the underserved community. Also, the Dr. Joanne Lewis Foundation will continue our monthly wellness program. So this month, for Heart Disease Awareness Month, February, we're going to have on Tuesday, Dr. Sajine Bien-Aimé that's going to present on heart disease and let us know some ways to, especially for prevention, to prevent heart disease, okay? What it is and how to prevent. And today I just want to take, as I'm walking with you, not too much of your time, but just a few minutes to really go over one particular type of heart disease, which is coronary artery disease, or also known as CAD, okay? So CAD is a condition of the heart where plaque or fat, cholesterol, calcium, it builds up inside the coronary arteries, the arteries of the heart, and it causes them to narrow and reduce blood flow to the heart muscle. And this process is normally called atherosclerosis, okay? So when the blood flow becomes too low or completely blocked, it can cause what's called angina, or also known as chest pain or a heart attack. So if you go on the CDC website, they have many risk factors, major risk factors for coronary artery disease, which actually these risk factors are almost the same for cancer also, okay? So any types of major medical problems, these heart disease like diabetes, these risk factors can cause things like diabetes also. So some of the major risk factors for coronary artery disease that you can change, like I said in a previous video, is high blood pressure, the levels of your bad cholesterol, smoking or secondhand smoke, don't be around anyone who smokes, diabetes, obesity or a high body mass index, or also known as BMI, physical inactivity, just sitting around all day, okay? If you're watching a show, you can get up and walk for 15 minutes while your show is going on. Don't just sit around. If you're eating an unhealthy diet, like a diet that's high in saturated fat, trans fat, sugar, salt, try to change it a little bit and eat a diet high in fruit, vegetables, etc. Stress, we talked about stress before. Chronic stress really puts a lot of strain on your heart, and so that can cause heart disease, okay? And poor sleep, we mentioned that before. I know, I'm like the pot calling the kettle black because I have poor sleep hygiene, but try to get enough sleep. And sleep apnea really increases your risk of heart disease. It puts a lot of strain on the heart, okay? And excess alcohol use. Don't overdrink, people. So risk factors that you can't change is your age. So men that are greater than 45 can't really change that. That's a risk factor. Women greater than 55, that's a risk factor. If you have a family history of early heart disease, you can't change that risk factor, okay? Sex, there's men higher risk earlier, so I said age 45. And women, after we reach menopause, our risk increases. And some genetic factors you can't change. And race, ethnicity, because heart disease is higher in blacks and South Asian, American, and Indian Alaskans, okay? So some prevention, quit smoking, eat a heart healthy diet. And actually, as I'm doing this last piece, I'm going to call my grandson because I love when he joins me. He gets so excited to join me. He was just eating, so we're going to wipe your mouth a little bit. So just walk with me, Ryan. Make this a family affair. Make it a friend group. I know it's cold outside right now. You can't really walk as much as you want to outside, but in the house, grab the kids, do about 15 minutes. I love him, he loves me, and so we just love walking together. And try to do some preventive things like not smoking at all, and if you are smoking, quit smoking. Eat a heart-healthy diet, a diet that's high in fruits, vegetables, whole grains, healthy fats.
I was actually just eating the orange.
You were? Good job. Give me a pound.
I mean, it tastes good.
Yes, it's awesome, right? Yeah. What else can you do, Rai?
I mean, mangoes taste good.
Yes.
Also,
you like fruits?
Yeah, I love all fruits.
All right. That's my grandson, y'all. All right, so regular exercise, try to aim for about 150 minutes a week of moderate activity, okay? Walking is really good, but high intensity walking is even better if we start putting some zep to the step, okay? Like I said, eating a low saturated fat and low sodium diet. Maintain a healthy weight. We all are struggling, people. And as I'm aging, about to hit chapter 58 in just a week, it gets harder to maintain a healthy weight, but if I continue to stay active and eat well, it becomes a little bit easier. And good news is that don't drink, so that helps. Just got to work on the sleep hygiene. And so for some medical prevention is controlling blood pressure and cholesterol, controlling your diabetes, get your regular checkups, and if you are on medication, take your medication as prescribed. So we went through a few things. We're gonna start probably tomorrow, just talk about some real things to do, and then we look forward to our talk from our speaker, Dr. Sajid Bien-Aimé. And oh my goodness, the time is just moving. Okay, we're gonna stop right here because it's gonna be hard for me to upload. So you all take care, love you, and be safe out here. Bye. Keep walking, right?